Hello and good evening, everyone.
And good evening, everyone.
It's really good to see people that have joined today. So thank you for joining. My name is Diane Jones and I'm the Chief Nurse for North East London CCG, Clinical Commissioning Group. And it's a real pleasure to be here today to host and chair this event, which is a really important event. It's very close to my heart, given that I am a midwife myself. And so just a bit about me, as you can see, I am a Black woman and I am a mother. And I think, you know, we've all got our birth experiences that we always remember, no matter how long ago they were. I've also got a daughter. And so one day she's going to experience her own journey through pregnancy. And what we all want is that everyone has a very safe journey through their pregnancy. And as you know, it was reported, I think it was in a report last year, that, you know, Black women are 5 times more likely to die in pregnancy or childbirth than white women. You know, and what we want is that women, all women are safe, and that includes certainly our Black women. And, you know, we want them to have really good outcomes. So there are safety concerns also that were highlighted in the Ockenden report that was published in December last year. Some of you may not be aware of that, but it's really important that we start to talk about these issues and that we educate our staff who are looking after the women, but also share with women what their risk factors are so that they can make really good informed decisions about their care and about what they want to do. So from the Ockenden report, there were 7 specific areas that they covered. One was around enhanced safety. There's one around listening to women and families. There was one around staff training and working together, managing complex pregnancy, risk assessments during pregnancy, fetal monitoring and informed consent. All really important areas that we need to think about. And so what we want to do is just to touch on that during this webinar, and hopefully it will be engaging and there'll be lots of questions and answers that we want to be able to be able to dispel maybe, and also to have that dialogue and that discussion. As much as we know that births are more dangerous for our Black Caribbean community, there's also an added risk factor. As we know, in the last 18 months, we've all heard about the COVID pandemic. And, you know, there is an issue that we've seen in our maternity units that women who are pregnant and have not been vaccinated are more likely to be unwell than women who have been vaccinated if they do contract the virus. And so we want to really make this raising an awareness as well amongst yourselves. But essentially it's about celebrating the births, because we all have our stories, whether we're a clinician that supported a woman through her journey, or we are or we're actually a culture or women, particularly as, you know, we've just gone through Black History Month, and, you know, Black History isn't just for October, it's all year round. And so, you know, I join you and invite you to be as conversationalists through this next hour with me and with others who I should be introducing. Thank you. We'll go to the next. Did you want to move it along for me, Safa? So I am introducing Lizzie Egbase to you, Dr. Elizabeth Egbase, our consultant obstetrician from the Royal London. So Dr. Egbase, it's over to you.
Hello, thank you. Thanks for that introduction. Yes, my name is Elizabeth Egbase. I'm one of the consultants at the Royal London. I've got a particular area of interest around patient safety, high risk obstetrics, and education. So I was really happy to be asked to take part in this event, and it's always really a privilege to be able to speak to our local maternity system. So thank you for having me. I'm just gonna so I've got some slides. So Safa, when you're ready, if you can, with the next slide. Thank you. So I guess this slide is really what I want to start by saying is that you know, we've called this celebrating Black births and celebrating you know, the sort of Black women and black birthing people. And I think it's really, really important that we acknowledge that, you know, in celebrating that, we have to acknowledge where we are with regards to some of the stark data that is out there and that remains, you know, continues to come out. You know, everyone knows about the Egbase report that was talking with regards to Black women being 5 times more likely to die in childbirth, and then the most recent one said 4 times more likely. You know, we all know about the disproportionate burden of the COVID-19 pandemic among Black pregnant people, and also people from a Black and ethnic minority background. And by that, we understand that, you know, women that are pregnant and from this background, you know, not just Black, but Southeast Asian, Latina, are more likely to be hospitalized, more likely to have adverse outcomes, and, you know, more likely to have long-term consequences as a result of the COVID-19 infection. Alongside that, we think about not just the sort of combination, not just the ethnicity, but the combination of socio and economic backgrounds as well. And I think that's really important because obviously, you know, we are in East London, you know, we've got a very vulnerable group of women that are in our community, and it's really I feel like it's our responsibility to really acknowledge that, and to make sure that the care that we're providing really is accessible and impactful to the women that, you know, we look after. We know Tower Hamlets is really not one of them, is one of the more socially deprived areas. And, you know, most recently there was a paper that was just brought out by local research, actually, a local research group, I should say, you know, who showed that the adverse pregnancy outcome was attributable to socioeconomic and ethnic inequalities in England. And this study really looked at over 1 million births, basically, and they found that in the study they were able to find that, you know, things like stillbirth, fetal growth restrictions, so having a small baby, preterm birth, were more likely to happen to those people that were, you know, in socio-economic and more deprived areas. But also when you accounted for race, it was even more impactful. And one of the things that they really talked about, I guess, well, they did talk about really was focusing on how we can prevent this, and focusing on the importance of, you know, really assessing our women, doing an appropriate risk assessment. They talk about taking the camera lens off. So, you know, you see you're a patient, and your sort of unconscious bias will take over, and actually it's acknowledging that and taking the lens off and thinking, okay, stepping away and, you know, what are you seeing, but what are you actually seeing, and trying to separate your own sort of cloudy lens based on unconscious bias from what your views are for the patient. And, you know, people even go as far as saying, you know, think about a patient and then think if they're from a different ethnicity, how would your treatment be the same? Would you approach it the same? And then there's simple things as well that we can be doing. You know, we need to understand that use opportunities to not only to do risk assessments, but to make women aware of how they can improve their own health. You know, we let them know about their risk factors, you know, people need to modify their BMI, and also really basic things like making sure that pregnant people are, you know, aware of the importance of vitamins, supplements, and nutrition. I mean, particularly vitamin D supplementation and vitamin D deficiency is massively linked to poorer COVID-19 outcomes. So, I mean, I don't think I'm telling you anything that most people don't already know, and it can be really quite a depressing, you know, state of affairs when we think about just that. But what I will say is, if you can go to the next slide, Safa. So yes, what I will say is that actually the big positive to come out of the spotlight being on Black maternity healthcare, Black maternity health experiences, is really the fact that now we're able to have these conversations openly. We're able to not only just have the conversations openly, we have women, Black women, who are at the forefront of driving these changes at, you know, government level, local level, and at an international level. So I'm sure most of you recognize the pictures that I've put up here of the Black women that I'm really admiring for the just the level of just tenacity, commitment, passion, and that they really do, you know, really flying the flag for Black women and really flying the flag for Black pregnant people, to have positive, safe birth outcomes. So we've got our lead midwife for the country, and we've got Tinike and Chloe, who were the co-founders of the 5 Times More campaign, which, you know, found themselves in Parliament not just once but twice, advocating for women's for maternity health care and advocating for changes in the care that Black women are receiving in order to reverse that stark statistic. We've got the 5 Times More campaign recommend on their website. I don't know if anyone's been to it yet, but they really have some good resources. So they've got the digital hypnobirthing pack and the pregnancy pack. And both of these resources are incredibly important because actually what they are focusing on is about, you know, the experience that Black women are having. But on top of that, they're focusing, both these resources provide a good amount of information and knowledge for women. So women that come armed with knowledge are able to really have, feel empowered, and empowered to take control over their care, ask the questions they need to ask. And the digital companion through pregnancy, which is the digital pregnancy pack, provides on-demand expert guidance that people can seek, and it's not overly expensive. It's about £30, and it really gives people the opportunity, women, Black birthing people and women, the opportunity to seek their own expert advice, potentially outside of the immediate healthcare setting, again to give them as much information as possible. What's really important as well is the lady at the top who was part of the team that pushed through and were able to develop and get signed off the Moderna vaccine. And, you know, I think it's really important that we see Black women scientists who are really part of the change. And for me, it really encourages me, and it makes me, it gives me faith, I guess, in the fact that we have people that are, you know, out there that are pushing the boundaries for us, and for the women that we look after. And we need people like them to help people like me on the shop floor. So the other thing I really wanted to highlight really was that, you know, there is a lot out there that's telling us that things are harder for Black women and Black birthing people to, you know, in today's society. But there's also information out there about the joyful, positive experiences that Black people are having when it comes to their birth experiences. And one such resource for that is the Birthright podcast. And it's an excellent podcast which where people come and talk about positive birthing experiences. And ultimately, you know, there's a quote that was on the last slide that was like, the psychology of everything will affect the physiology of everything. And I think it's really important that we remember that, because, you know, the message out there is really can be quite scary, and actually, you know, we need to be balancing that out by thinking about the positive, the potential change that is on its way, and you know, the admirable people that are really driving that change. So next slide. Thanks, Safa. So yeah, so the next thing, I just wanted to highlight a few things. So 5 Times More campaign. If I know we're hoping that we've got some birthing people on the calls. So it's just really important. I wanted to make it clear that, you know, they have really clear guidelines on tips how to make sure that you have a really positive or safe birthing experience, like speaking up, finding an advocate, seeking a second opinion, trusting your gut feeling, doing your own research, and make sure that you document everything. Next slide, Safa. And for us as healthcare professionals, you know, really we need to be thinking about 5 main things. One, we need to listen to the women. And in order to do that, you know, we need to be able to remove any barriers to communication. So active listening really does involve removing the barriers to communication. We want to make sure that we're providing clear information to our women that we're looking after. And we want to make sure that they have access to detailed documentation, and is important, and it's something that I find really that speaks to me, is about being a champion for the women that we look after. Next slide, Safa. So a lot of the resources that we think about when we think about improving the and celebrating Black births and making sure that people have safe, positive birth experience. So many things you'll find actually in the United States, but actually there are some really good endeavours that are taking place here in the UK, and are really positive things that I would really encourage people to research and have a look at. So you've got the Abuelas doulas, which are the first Black owned, founded and created UK doula course, and they have their a network of doulas, majority from a BAME background, whose real sort of passion and drive is being birth advocates for Black women and women of color. And, you know, typically things like doulas, hypnobirthing, all these things, I think from my own experience have been quite sort of not something that has been as accessible, I believe, to Black women, you know, because of risk factors, because of, you know, I understand ideas around Black births. Often it's quite medicalized. And so, you know, it really is a positive step, a step in the right direction, that we're seeing these things that are often afforded to women that are, you know, Caucasian women, that are being embraced by the Black community. In addition, they've got things like Birth Workers of Colour. This is again another UK organisation looking for which sort of represents, I guess, doulas. And different like types of birth workers, independent midwives, etc. And then my own personal sort of group that I feel that I hold close to my heart and I'm a part of is Black Health Matters. And this is actually a London organisation. And basically with Black Health Matters, we are doing a lot of work about lived experience leaders. And so lived experience leaders are change makers, innovators, and leaders who've activated their own lived experience to be able to inform, shape, and lead social purpose work. And actually, by doing so, they're directly benefiting the communities of those that they share the experiences with. So we talk about the importance of having, you know, Black women speaking to other Black women, Black birthing people speaking to other Black birthing people about, you know, their birth experiences, their experiences of a certain unit, how to get the most out of their, you know, their birth experience, how to express themselves, how to, you know, find the right place for them to deliver, you know, what's the right mode of delivery. And they'll really find these things beneficial because it really does empower women to have people that look like them as part of their birthing team. My last slide is about the COVID-19 vaccine, but I don't know if I'm going to go there because I believe that there's actually a lot more specific information that's going to be coming from our next speaker. So yeah, I will leave it there. Thank you.
Thank you, Lizzie. Hi everyone. I'm Dr. Jagan John. I'm a GP in East London and chair of North East London CCG. And as part of this fantastic celebration of Black women's births, one of my roles is to, with my colleagues, is to make sure that it is as easy as possible for you to A, ask questions, but B, also go somewhere where you'd like to have the vaccine going forward, and if you've made that decision. So moving to the next slide, we have in North East London over 100 choices, and they vary between hospitals, local vaccination centres, some GP surgeries in some cases, and also our pharmacists as well. And there's nothing prescriptive about this. This is about you thinking, deciding, talking with your partner or talking with your family to decide whether you'd like to have the vaccine. And a lot of the time, sometimes I get questions when I work in the vaccine centres. They get questions, just people want to have a chat, have some reassurance, want to talk about particularly medical problems that they're concerned about, and they come in and they ask, and it's okay. And if you don't want to have it that time, that's okay as well. So if you did decide you wanted to have the vaccine, all these centres can be booked through the nhs.uk website, where you can get the vaccine. You get a prompt, and then you can choose where you'd like to go. And then on top of that, you will be given some choices, of the nearest centres, and also where you'd prefer going forward. I mean, there are lots of choices out there, and I always say it is always a personal decision, and it's okay to think and ask questions. And there's no one there in any of the vaccination centres who will be, in some respects, pushing you to get a vaccine. And you've heard from our fantastic speaker, Lizzie, and all those fantastic organisations. And a lot of those organisations, as Lizzie says, is really about, talking and really reassuring you about the decision you want to make for you and your baby. And if you're not pregnant, it is also talking about fertility and the concerns that people might have. But I will say, and I think Lizzie mentioned it, that the vaccines are safe. We recommend it in pregnancy. We worry about pregnancy as a potential risk for particularly due to COVID. And that's why we're really pushing hard to say, look, really consider it for you and your baby. If we go to the next slide. So this is just hot off the press, down to some of our colleagues who've discussed this, but also fantastically, our fantastic staff in the hospitals have also supported this. And for example, in the different trusts, they're offering vaccines at that centre. So when you're going in, you could potentially have it at a similar time to some of your clinic times. And we always really advocate us all considering to get a COVID vaccine. Now, most of us as health professionals, if not a large proportion of us, have already had the vaccines. I've had mine, my wife's had mine, and even my children have had the vaccines as well. So this is really by, not only am I recommending and saying, look, please think about it, but I'm actually doing it to, giving the vaccines to my own family. So I'm sure our midwife colleagues and our maternity units are always willing to have a discussion with yourself about the vaccine. And I really think, we've got some really fantastic advocates like Lizzie and others who are just fantastic, who've just been promoting and supporting our Afro-Caribbean women to make the decisions best for them and their children. Next question, next slide. So I'm going to hand over to my consultant midwife colleague, Rosemary Jage. Rosemary, over to you.
Thank you, John. Good evening, everybody. My name is Rosemary Jage, consultant midwife at Queen's Hospital, Romford. It's a delight to be with you this evening, celebrating Black women's births. This evening, as well as talking about the importance of the COVID vaccine and the impact it's having in relation to the coronavirus pandemic. It's also about celebrating Black women's births, and as well celebrating the contribution Black women make to the community. I know there are a number of maternity mates in our East London region, especially in the Tower Hamlets area, who support women in labor in the postnatal period, especially women who don't speak English. So I just want to say well done and thank you for all that you do in relation to bringing women together, your little coffee mornings that you've been having to support women in your peer groups has not gone unnoticed. And also the contribution you're making into being a peer support for your friends, your family, and women who are pregnant within your communities. That way we can ensure that we're empowering women and giving them the information they require to make an informed choice. I also just want to reiterate that maternity services remain open. I know that because of the changes in relation to visiting and reducing the footfall in our services, there had been changes to maternity services. Visiting still has its restrictions, but our maternity services are open. So please, if you're worried about yourself, worried about your unborn baby, or have any concerns at all, please attend maternity services. Don't stay home and worry in silence and thinking about what you're going to do or whether we are open or not. There is full infection control policy in place. So the midwives, maternity support workers, obstetricians and nurses wear masks, or we all wear masks in the clinical area, just to reassure you of the safety of our premises. We also have information to support you in your decision making. So this evening, as well as giving you all the information and the statistics around COVID vaccine, it's also about empowering every individual woman on this call. That is your decision to make, and we respect your decision. As John said, you may not have made the decision to take the vaccine at the time, but please feel reassured that it is entirely your decision to make in relation to the coronavirus vaccine. Lastly, I would just want to finish to say that we also have support from our Maternity Voices partnership. So if you've had your baby in Queen's Hospital and would like to give us feedback on how we can improve our service or plan our service to fit your individual needs, we want to hear from you. And I'm sure other maternity services within our LMS as well are keen to hear the experiences of our women, especially within the coronavirus pandemic and how it has impacted on their experience and has impacted on their care. So let us know your feedback. Let us hear from you. We are happy to help you, and we will do our best to plan services to meet your needs. Thank you. Over to you, Safa.
Okay, so thank you so much. You've had some really insightful words from our speakers, and I just want to reiterate thank you all. And I've been looking at the chat, and clearly people have really welcomed, you know, your contributions. So I think just before we go into some questions, just to reiterate that our maternity services are open. I'm a midwife myself, and I actually worked. I did a shift last week in the maternity unit, and it is absolutely safe. And as you say, we're all practicing very safe measures to keep our mothers and babies and their families very safe. So, you know, we really do want to reiterate that our services are safe. We're also very much supporting women's choice. Women need to make an informed choice about themselves and for them and their babies. What we want to do is to make sure that we give all the information that we can in a way that's suitable for each woman, because they are, you know, everyone's an individual. But to enable women to make that informed choice, they need the information. So what we want to do is to share that information with you so that you can make sure that you are also being informed yourself or informing your colleagues. It could be your sister, your aunt, or anybody that you feel is pregnant, just being able to signpost them to the right place for them to make some of those decisions. We've put some links here for you so that you can take away, and that will be in the chats in terms of where you can go for further advice. So obviously, please do not hesitate to get in contact and use these links. We do have a local maternity service, the LMS, where that's the primary aim of that LMS is to ensure that we can meet the needs of our population and to make birth safe so that every baby is born safely or as safe as possible. So we've finished in terms of the views from us. What we will go into is a very much a short. Well, we'll do the question and answer, but we do have a short video as well to reiterate some of the women's experiences, because obviously a lot of this, what we want to do is to engage with women in our population. And I've seen one of the questions in the chat about sometimes Black women are underrepresented. So what we do want to do is to make sure that we can hear voices of all of our women, all of our pregnant women, but particularly those where there is underrepresentation. So Safa, over to you in terms of questions and answers, if you want to facilitate that.
Thank you, Diane. So we'll now ask our panel members to stay on the call. So we have Diane Jones, who's the Chief Nurse and Caldecott Guardian for North East London CCG. We've got Dr. Jagan John, who's a GP in East London, and our Chair for North East London CCG, Rosemary Ildiaghe, who's the consultant midwife at Queen's Hospital, and also Dr. Elizabeth Egbase, who is our consultant obstetrician as well. Thank you, everybody, for your really important points and information. I've definitely learned a couple of things myself that I didn't know before today as well. What we are going to do is we're going to start with a couple of questions that have been emailed into the East London local maternity service, and so we're going to start with a question that is actually for Dr. Egbase. So this question is from a pregnant woman who identifies as a Black African, didn't want to share her name. So she's asking, I had the AstraZeneca COVID-19 vaccine in May 2021. I then fell pregnant. I was due to have my second jab, but I chose not to, as AstraZeneca has not been approved in pregnancy. I feel very nervous about taking the AstraZeneca vaccine. I've been told I can't have the Pfizer or Moderna vaccination as my second dose. What advice would you give to me? I do want to have the vaccination, the second dose, but I'm hearing different things. And that's to Dr. Egbase.
Thanks, Safa, and thanks for the to whoever sent the question. I think it's an interesting a question, and I think it's a genuine dilemma that a lot of people are having, and it's there's different layers to it. I think amongst our community there's a probably fair distrust about potential vaccines. People are scared it's rolled out very quickly. They've been scared, people are concerned like Black people are going to be the guinea pigs, or there's so much misinformation that even came around in the first part of COVID, like Black people can't get COVID. I don't know if anyone got that, but Black people can't get COVID. My mum was very convinced about that at the beginning. And I think that because there's been so much misinformation, it can be quite difficult to trust the new information that comes, especially when sometimes the health information gets conflated with the policies and stuff like that. So people get confused, I should be isolating, not isolating, and then you throw vaccine in the mix and things get mixed up. But what I would say to that person is that actually where we are now, 18 months into the pandemic, the data around the safety of vaccines is strong. And what's actually probably stronger than that is the data around, when pregnant people having adverse outcomes when they get COVID and they're not vaccinated. We know that, that's, if you're, the majority of people in this most recent wave dealing with Delta and Delta Plus, who ended up in ITU or ending up sadly dying from COVID-19 when they were pregnant were Black women or Black or brown women. And that is a very, very strong area of concern for us as obstetricians, as clinicians, as wives, mothers, nieces, nephews, everything. It's very, very stressful. And I think that we have to, it can feel like you're stuck between a rock and a hard place, but we have to go with what the science is telling us and also really go with what we know to be true. And often when you have lots of questions and you don't really know what to do, the best thing to do really is to discuss it with a healthcare professional, write the questions down before you go and see them, try and go through all the questions that you would like, and they, even if they don't have the 100% answer straight away, there's definitely ways in which we can find answers and things like that that could help you feel more comfortable in the decision, because it sounds like that person does actually want the vaccine, but they're just afraid. And I think if anyone, you know, most people, that's kind of where they are at the moment. So yeah, so I would really encourage them to sort of block out some of the background noise and, you know, speak to a healthcare professional and just, you know, go through their concerns one by one with them.
Thank you. Does anybody else from the panel wish to add or have any reflections to add to Jagan? Do you want to come in?
Thank you. Echo completely Lizzie's comments and words. They're very well, very, you know, wise words. You know, it is a decision. It's a local decision. But to answering the question regarding the AstraZeneca, the current evidence from the UK Health Protection Agency in the Green Book is like our Bible of vaccination. They would say carry on and take the second dose for the AstraZeneca. That's what we recommend at the moment. But again, like Lizzie says, it's a decision. You have to. You can mix vaccines. You can mix it. There is still more data, so there are people who are uncomfortable with having, for example, the AstraZeneca again. Although in most of the units, and I'm sure Lizzie will say the same, that we encourage people to complete the second vaccine because of the immunity, and it is better for the protection wise going forward. There is some evidence to say that if you mix vaccines, for example, the vaccines now are all, we tend to use mRNA vaccines, which are not live vaccines, hence why we recommend them in pregnancy. So it's a bit like the flu, they're not live vaccines. And generally, if you're starting from scratch, it's, you know, the Pfizer or the Moderna vaccine currently. Is that right, Lizzie? I'm pretty sure that's where we're at. So the answer is, to answer a question, we would recommend AstraZeneca. You complete the dose, because the benefits of having two vaccines for you and your baby, and for people like Lizzie, our consultant colleagues who have to deal with, you know, premature births and things like this that were found in COVID, we recommend. But I wholly support what Lizzie's saying. It's a decision. It's something you need to carefully discuss, and it is a decision that only you can make with the right information, and also really respecting your circumstances and your particular issues as well. So wholly kind of supporting our consultant colleagues. But just to say, if you came to any of our vaccination centre, that's what we'd be saying. Safa.
Thank you very much for that. I'll just keep the two of you on the mic per se, just for the next question, because next question is a clinical question as well. So the next question relates to postnatal kind of effects potentially. And that's come through privately on the chat function. And that is, could there be long-term effects on health from the vaccine for the baby or for me? I'm not convinced that there's enough data yet. So if we can bring in Dr. Jagan and Dr. Elizabeth Egbase again to take that question.
Yes, thank you. I mean, I think there really is data now that's the benefit of where we are at the moment. You know, in the United States, they've given, you know, close to 200,000 women have had completed their COVID vaccine doses, and we know that the vaccine itself doesn't cross the placenta, but the antibodies that you produce, so they're the things that help fight the infection, they do cross the placenta, and again, you can release antibodies in breast milk too. So that is actually protective for baby. You know, we don't have any, from the big amount of data they've got from the US, there's no signs of any sort of birth defects or anything like that that come as a result of having the vaccine. And I think for everybody, it's always going to be a matter of risk versus benefit. You know, I think if it's realistic for you to spend however long inside, just you and your baby, not going to the shops, not having any visitors, not you know, not basically just being in a bubble for a lot of the time and really not being exposed at all, then, you know, that, and you can guarantee you'll have no exposure, then that's a different story. But, you know, the reality of the life that we live is that that's not the case. Even if you're opening the front door for the post, or, you know, running down to the shops, or you want to be able to go to baby groups and you want to be able to socialize with other mothers and have support that you need, you know, the vaccine, taking the vaccine potentially can help with that, can help you get back a bit more to normal life. You know, people felt really isolated at the beginning when they were pregnant with COVID. No one knew what was going on. Everyone was just at home. You know, people like were really, really struggling from a mental health perspective. And we know when you're postnatal, it's so important to have that support. And, you know, it's really, like I said, it's a risk and benefit. And I think we know that it's safe for the baby. It's not going to have any effects, there's no evidence of any adverse effect to your baby. If anything, we think that it's protective for baby because of the antibodies. So Dr. Jagan, I don't know what you think.
Yeah, so absolutely right. There was so it's constant. We're constantly monitoring this, and there is a system of monitoring across the UK. We're quite lucky in this country that we always tabulate any kind of effects or any kind of problems. There was a publication, I think, in the American Journal of Obstetrics and Gynae, I think in August of this year, from St. George's, one of our own universities, and they looked at the pregnancy outcomes of people and the babies with the people who've had the COVID-19 jab and those without, and they compared the two groups, and they found that there wasn't any increase of stillbirths. There wasn't in the COVID-19 jabbed group, that is, there was no increase in stillbirths, no premature births in the patients who had the COVID-19 jab, and there was no abnormalities or development or no evidence of any of the babies being smaller or bigger in that group in the patients who had COVID-19 jab during their pregnancy. So I mean, there's lots of other studies. I think there's in 4 countries there was 40,000 women, I think, who and again, similar thing, it didn't increase the risk of small for gestational age, i.e. small for the age of the baby, or congenital abnormalities in the baby after pregnancy. And they did those, that's 40,000 women in 4 different countries. So as our consultant colleagues, Lizzie has said, there's quite a good amount of evidence now worldwide, and it is being monitored in every country. And people ask me all the questions, said, well, why is there got so much evidence now in such a short time? It's because COVID is the only thing in everyone's agenda. And there has been so much input and interest in looking at COVID-19 vaccine safety, which we wouldn't normally do in, you know, because there's so many jabs out there. But if you think for the last 18 to 24 months, all we've been focusing on, every country, every government, all our clinical and medical colleagues, as well as our patients, they've been focusing on, you know, the effects of this going forward. So I think, as Lizzie has said, we've certainly, we wouldn't advocate, people like myself or Lizzie or any of our colleagues on this call wouldn't advocate something that we would think would put any of your children at risk or you at risk. And that's why we're here, because we strongly believe as a collective group that this is the right thing to help protect you, most importantly, and your child.
Thank you very much. Some really powerful words from both Dr. Jagan John and Dr. Lizzie Egbase as well. We're going to take 2 more questions from the chat and then open up to anybody who has any questions that they want to ask anybody on our panel. The next question I'm actually going to bring in Diane Jones and Rosemary Ildiaghe, who is a consultant midwife, and we're just going to combine that. So we're hearing in the chat some themes around our services. What can we do? What more can we do to support Black women to access our maternity services, our birth options and birth reflection services, and we've also had comments about what more can we do to engage Black women, Black people, to help us co-produce. And when we say co-produce, we usually mean design services together in our maternity services. What are both of your kind of reflections on that point around how we engage, particularly Black women, to support us to make services better for Black women?
Diane, shall I go first? Okay, thank you, Rafa. Yes, I did put a response in the chat, but I think the question or the comment is a very valid one. First of all, I want to just say kudos to the work that the 5 Times More group and the Motherhood group are doing. They have sort of revolutionized everything surrounding Black birth, and added the elements, very significant elements of empowerment for our women. And it's actually putting the power back into our Black women, saying it's okay to ask questions. It's okay to ask for a second opinion. And we do really want to hear your voice. And that has also engaged discussions around understanding our unconscious bias as well as healthcare professionals, and understanding how the impact of that unconscious bias affects the care the woman receives and also her outcomes. So I agree with you, there is a lot that we can do, and I think it's about also supporting our women in navigating our sometimes complex maternity services, especially where English is not the woman's first language. There's things around ensuring the woman can understand the information we provide in a way that she can understand. And of course, it is when the woman understands what we're saying that she can begin to ask questions and seek clarity. So utilizing interpreters, language line, and also sharing that information with the wider community as well, reaching out to the women where they are, and not always expecting that the women will come to us, which is what we're doing a lot of the times in our local maternity system, reaching out in children's centers, supermarkets, where we know that the women will be, especially in their places of worship. So we are constantly looking to hear your feedback as well. And it's really good that our LMS has got the very keen, very focused, and also a very diverse group of maternity voices partnerships who are working within our women's community to also improve the experiences and outcomes of our women. And what I will say that giving voices back and giving power to our women, it's also about taking that ownership. So for every woman on this call, I am saying to you, please take back that power. It's in your hands. And if you're not happy with the care that you're receiving, open your mouth and say you are not happy. I would like to speak to somebody else because I am not clear about what is going on. It's your right, it's your body. Take back that power. Thank you. Diane, over to you.
Thank you. So, and I would add to that, and I think you're absolutely right. And I think that the way that we engage with the public has to change. Fundamentally, we as healthcare workers, and I use the royal we're probably a bit lazy in that we reach out to the traditional areas to gain information and to get that engagement. And I think in this digital age, there are so many different ways that we're going to have to engage with our groups, and particularly around those that we seldomly hear from. It usually is in maternity that it is normally and I'm going back a while now, we used to have these maternity services liaison committees, they were called MSLCs, and it usually were white middle class women that were really the champions for maternity. Quite rightly, they had a voice and they helped us to shape maternity services. And I think, as we move forward in this digital age, and we've got Instagram and we've got Facebook and all these other areas, we need to start reaching out to those groups to start to invite women and go to where women are to get their views. And as we were saying, though, sometimes it's places of worship that we may need to go to. Showing a bit about me here, I'm going to something called a reggae bingo. Never been to bingo before, but there's a reggae bingo. So, you know, there's going to be a lot of young women, childbearing age there. I'm pretending I'm in that group, but I'm not. You know, we need to reach out to those places and speak to women, and, you know, we can, you know, and start to invite. And why don't we do an event that brings people together where we can share views? So, you know, I think we need to really shake it up and really do things differently. And I think as the Chief Nurse for North East London, and I know I've got the support from the network of the LMS, and I know I've got the support of the community that we're in, we're really looking to be really diverse in our engagement. And so really welcome any ideas that people want to bring forward about how we engage our communities, because I don't believe the traditional method is the ones that we should be using. I think we've got to do very differently, go into those communities and to listen and hear and make an effort to listen to people who we seldomly hear from. I think they may be sceptical to start with if we've never been interested in them before. So, for example, if we had a group of homeless people who may be of a certain ethnicity, if we've never reached out to hear the voices of homeless people, when we're going to hear it now, they'll think, well, why are you coming to me now? And that could be the same with our Black community that says, you've never bothered about me before, you've never cared for me before, so why do you want to hear now? And we've got to be able to earn their trust, you know, and we've got to start building those bridges and earn their trust. And I think through people who look like them, who represents them, I think that that's a step forward, that we need to work together in that way.
Thank you both. I don't know about everybody else on the call, but I certainly feel really fired up by everything that you've said. And do you know what I'm going to say? I think everyone on our panel needs to be spokespeople on this theme, because you raised some really, really great points. I mean, why shouldn't we be having a reggae bingo night? Because I think, you know, as somebody who's worked in the vaccination program myself, you know, people have lives, interests, hobbies. This is all part and parcel of our lives. And, you know, there's absolutely no way why music cultures can bring us together to talk about some of the kind of more hard-hitting and serious things that are happening at the moment. On the same theme, we have a slightly longer question, and it's going to be our last question for the night. But please do keep emailing us. We're going to put our email address in the chat again. This is a conversation that doesn't end when this webinar ends, and we want you to get in touch with us, and we want you to carry on speaking to us and carrying on having these conversations with your friends around your dinner tables, and in your communities and in your workplaces as well. The more we talk about it, the more we have these open conversations. So the final question that we'll just take from the chat is from somebody who works within our system. So it says, I am a Black midwife, and some of the conversations that I have with pregnant women feel slightly different to conversations that pregnant women have with midwives that are not themselves of an ethnic minority. So we're talking about faith. We are speaking about some concerns and messages in the community. One woman told me that she trusts God, and therefore she didn't want to have the vaccination, and feels protected whilst being pregnant. What advice would you give to people like us on the front line who might have had concerns of our own, and we'd be supporting women? So I guess anybody really, but probably more towards kind of Rosemary and Dr. Egbase, who are on the front line and working within our midwifery and obstetric services.
Okay, shall I go first, Diane? Yeah, okay, thank you for that, Safa. I think first of all is to acknowledge that our women are diverse. There isn't one size that fits all, and it's perfectly normal to have a faith. If a woman believes that the vaccine, that her faith will protect her, that's entirely her choice. That is entirely her way of expressing her faith. It's also important for women to understand that there is no judgment and it's not in any way going to impact on the care. Very importantly, this needs to be highlighted. Really, it's important for women to understand that there is no judgment, and whether or not they choose to take the vaccine, it's not going to impact negatively in their access of maternity services. And I don't want any woman to leave here this evening thinking, oh, if I don't have the virus, if I don't have the vaccine, then it might impact my care negatively. Absolutely not. And in relation to what the midwife has put on the as a question, I think it's important for us to also continue to protect ourselves. Again, I think the same conversation flows in with staff, because we have some staff that we work with that haven't taken up the coronavirus vaccine. And so it's about us ensuring that we are protecting ourselves by wearing PPE at work and utilizing universal precaution, hand gel, simple hand washing techniques that we use in our homes. The same things apply at work, and also maintaining a reasonable distance. I think it's also important to ensure that if we are unwell or have any symptoms at all, we stay away from work to keep our colleagues and also keep our women safe. It's very important to reiterate that. I know that there are staffing pressures that has been compounded with the coronavirus pandemic and the effects of it, but that does not mean that as well that we should put ourselves or our colleagues or our women at risk. So it's about ensuring that we remain fully protected, utilizing our PPE, staying away if we're unwell, and also utilizing the services and the advice that the occupational health team have for us to support ourselves as colleagues at work. Diane, did you want to add anything, or anybody else?
Yeah, no, I totally agree with what you said.
Jim for the 5 millionth time this video.
Sorry, I think, can colleagues go on mute, please?
$40,000.
Colleagues need to go on mute. There you go. Over to you, Dr. Egbase.
Yeah, I completely agree and echo with what you've said. I think, particularly the part around around reassuring our women that you know, their decision whether to take the vaccine or not to take the vaccine is their decision. You know, for us, it's like any sort of medical decision people make. You know, it's my, you know, our responsibility as healthcare professionals to give you all the information and to empower you to make a choice that you know, that is an informed choice. And then, you know, we support you through whatever that choice may be. And I think the vaccine is no different. And I think, like everything in maternity, to be honest, you know, there's always you know, people that maybe want to do something or pursue a route that is not necessarily something that we would, you know, be jumping on board with straight away or would even recommend. But what we do know as a profession and as a healthcare service within maternity is that we always do our best to keep it safe, irrespective of what the options, what the choices that somebody is making. And I think it is a personal choice. You know, my mum, she's a mental health nurse, and it took some persuading to get her to have the COVID-19 vaccine. She was not keen. Even though she, you know, she's got high blood pressure, she's overweight, you know, all these other, she was, you know, real risk. But, you know, and even though she has 3 children that work in the NHS, one of whom I've had COVID twice. And so I'm trying to explain to her, like, listen, you really, really want to take this vaccine. But it wasn't, you know, that's not what she wanted to hear initially. And it actually took a number of conversations from different angles you know, and then she ended up getting the vaccine. And actually, when we all got the vaccine, she then felt like, oh, I'm the only one that hasn't got it, so I'm going to get the vaccine now. And I think it's one of those things where it's about building trust with our women, and while women trusting us, you know, if they may not trust the bigger picture or the bigger message that's coming from government or whatever, but if they trust you as a healthcare professional, they trust that, you know, us as a unit, that we're looking out for them and we want what's best for them, and what we're suggesting to them is something that we've done ourselves, we would encourage our friends and family to do. I think that as an element of credence to what we're saying, and also being empathetic. You know, all Black people aren't the same. Everybody, you know, we're not a monolith. Everybody has different cultural influences, and depending on where people are, their culture and their community is definitely going to potentially have a bigger impact than what I'm saying to them as a Black woman, you know, and I have to acknowledge that and do my best to work with that. So yeah, so I really just think it's the message really is that we just keep trying and try and make it as non-judgmental as possible conversation, and make sure that they know that the door continues to remain open for, you know, for safe, positive care, irrespective of that decision, but then also encourage them.
Thank you. I would only add two things very quickly, Safa, if I may. One is that if those of us who are healthcare professionals, our opinions and our personal opinions should not cloud how we interact with women. We've got to deliver information in an objective way. So we may have personal views, but we've got to give all the information and be objective about that. The other thing is, I think as healthcare professionals, we need to be culturally conscious in terms of the woman's culture who we're speaking to. We all have a responsibility to understand where she's coming from by asking her. We are not here to be experts in anyone else's culture, and we're not here to make assumptions, but I would say raising awareness, being culturally conscious, speaking to that woman and understanding her culture, because we all come from very different cultures. As Dr. Egbase said, we may all be Black or Asian people, but we have very, very different cultures as well. So let's not make assumptions, and let's make ourselves more aware of everyone's culture. Thank you.
Thank you. Apologies, we have run slightly over, but this could easily be a 2 or 3 hour conversation if we wanted it to be, but do want to give people their evenings back. Thank you everybody for taking part in the Q&A. As I said, the email address for the East London local maternity system is in the chat. This is the start of a conversation, and lots of really, really great comments in the chat. And something I want to reiterate as well. Today was the start of a public conversation celebrating Black women's births. And we have been speaking about the COVID-19 vaccination because Black women are telling us it's an important thing that they want to speak about, or they're worried or have concerns about the decisions that they're making. And it is a start. We do, as a system, want to have more of these conversations within our Maternity Voices partnerships and in future events as well. So please don't feel like you couldn't have a say, or that we focus too much on the COVID-19 vaccination. This is what our questions have been around today, and we do want to do more to celebrate Black women's births as we go on. Handing back quickly to Diane to close and say thank you.
So I'm not going to say any more other than thank you to all of our speakers, and thank you to you for attending as well. And I hope that for those of you who are working in maternity units, I hope that I can come and see you when I'm doing my rounds of visiting the maternity units, and I'm working alongside some of you as well. So I recognise some of you that I know that I'll be working alongside as well. So thank you all very much, and hope to see you again soon. Bye-bye.
Thank you.
I'm going to put it into the working.